Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in the region of Peel, Darren Rizzi, our Fire Chief and Director of Emergency Management, Sam Rogers, our Director of Enforcement, for any questions that you may have about enforcement will be available online later. And this week, we're joined by a very special guest, Dr. Ato Suki Otu. Hope I got that right, an orthopedic surgeon at William Osler Hospital and a member of the Black Physicians Association of Ontario. Dr. Ato Suki Otu will be speaking a little later about the Black Health Vaccine Initiative started by the Black Physicians Association, an initiative that is coordinating Black doctors, nurses, and other medical staff to get more members of the Black community vaccinated and to address vaccine hesitancy in the Black community. Well, it has been a very busy few days in terms of changes to Ontario's vaccine rollout, with a seemingly endless number of new announcements and new information. And I know this has resulted in significant confusion among residents and businesses. We have been trying to clarify and answer all your calls, emails, texts, and messages. My team, as well as the city staff, have been trying to make sense of it all, just as you have. It's important as leaders that we set realistic expectations and be clear about what we are doing and what is actually possible with the resources that we currently have. Today, I want to address who is eligible for vaccination in Peel, where the vaccinations will take place, and who will be delivering the vaccines. I also want to talk about the vaccine supply. I can only speak for Peel and Mississauga specifically, not for what other regions or cities are doing. It is important for residents and businesses to know what is actually happening and what is actually possible right now. Let's start with who is eligible for the vaccine. Mississauga residents 60 and older can book a vaccination at any of our mass vaccination centres or with our hospital partners. The easiest way to do this is by visiting peelregion.ca/COVID-19 vaccine or by calling 1-888-999-6488. All Indigenous adults, healthcare workers, all people with the highest risk health conditions can also book vaccinations at these locations. And specifically, these are for Moderna or Pfizer vaccines. Residents 55 years age and older can also receive the AstraZeneca vaccine at one of 43 pharmacies in Peel Region, 25 of which are in Mississauga, that are taking part in the pharmacy vaccination program. All the information you need to book an appointment and what pharmacies are offering the vaccine can also be found at peelregion.ca/COVID-19 vaccine. Now, some confusion occurred last week with the announcements that came late in the week that expanded the eligibility of new groups of people in hotspot postal codes. So let me try to clear this up. Right now, any resident 50 years of age and older who lives in an identified hotspot postal code can book an appointment at any one of our mass vaccination centres through the provincial booking system or directly with our hospital partners. The provincial list of hotspot postal codes can be found on Peel Public Health's website, as well as information on how to book an appointment. All in-school educators, as well as custodians, school bus drivers, and administrative staff who work or live in hotspot postal codes can book a vaccination regardless of their age. Educators will receive information from their school boards and must book an appointment by calling 1-833-943-3900. All special ed staff who support students with complex needs can book a vaccination and don't have to live in a hotspot postal code to book. They are eligible if they live or work anywhere in Peel. They can book by calling that same phone number, 1-833-943-3900. Again, this is for the Pfizer or the Moderna vaccine. Last Friday, the Premier also announced that residents 18 years of age and older in hotspot postal codes would be eligible for the vaccine beginning this week through pop-up clinics and mobile teams. This led to us being inundated with questions from many of you wanting to know when and where they could sign up. Where would that pop-up clinic occur? When was that mobile team coming out to their neighborhood? The reality is that we received the news at the same time you did, and neither Peel Public Health nor our hospital partners have received a commitment for additional supply of vaccine to accommodate these new categories, the mobile and pop-up clinics, and sufficient supply of vaccine to continue throughout the existing framework. I will repeat, we have not yet received a commitment for additional vaccine to accommodate the new categories or to continue through the existing framework to make that all happen. I know that the Premier announced this with the best of intentions, but in order to vaccinate everyone 18 years of age and older in these hotspot postal codes, we may need more vaccine. It is also important to highlight that when these mobile and pop-up clinics begin, they will target the highest risk populations within these hotspot postal codes. For example, certain blocks in high-risk neighborhoods, residential buildings, religious places of worship, or education workers in hotspot postal codes. And because this is a highly targeted approach, these pop-up and mobile clinics will not be widely advertised, and people will not be able to book through the provincial booking system. These are tools to target our highest risk residents, including our essential workers who can't work from home, and residents who have faced barriers in getting the vaccination at one of our mass vaccination sites. I know that Dr. Lowe and his team are busy working on a plan with the province to determine when and where mobile and pop-up clinics will be used. Residents 18 and older in Malton with a postal code starting with the digits L4T are able to register for a pop-up clinic taking place at the BAPS Mandir over the next 3 weeks. Brampton residents with a postal code starting with L6S will also be able to register. Residents with these postal codes can book an appointment directly on William Osler's website at williamoslerhs.ca. I want to thank the province, thank you, Premier, for making more vaccines available to our most vulnerable residents. We have an incredibly high number of essential workers and vulnerable populations in Mississauga and in Peel, and I have been advocating for the province to prioritize these residents in the vaccine rollout. But I do want to stress again that it is likely that this is not how the majority of people 18 plus and older in hotspot postal codes in Mississauga will receive their vaccine. We have simply not received enough supply to make the vaccine widely available to all residents 18 and older through pop-up and mobile clinics or at the mass vaccination sites. The reality is that 85% of Peel's population live in these identified hotspots. And that means almost everyone going through our mass clinics system right now comes from a hotspot identified by the province. And unlike Toronto, we do not have a large hospital network that has the capacity to oversee pop-up clinics on a mass scale. The province also announced yesterday that some eligible employers in hotspot postal codes will be able to set up clinics on their own premises. I want to be very clear about the requirements for employers to be eligible. Employers must, first, be located within an identified hotspot, and have had a previous COVID-19 outbreak or at risk of a COVID-19 outbreak. The on-site clinic will vaccinate employees that cannot work from home. The employer will also vaccinate those in the local community, either at the on-site clinic or at an alternative location in consultation with the local public health unit. The employer will bear all the responsibility of setting up, operating and funding the on-site vaccination clinics, as well as the community clinics being sponsored if not on-site. This includes being able to lead the following: program planning, governance, communication protocols, clinic planning, logistics, oversight of receiving, storage and movement of the vaccine itself, IT, data, reporting, site and clinic security. This is a huge undertaking for any business, so I want to provide as much detail as I can on what is expected of employers if they are thinking about running an immunization clinic on their premises. Employers that are interested in setting up a vaccination clinic can email COVID-19 Task Force at ontario.ca. Let me say that again. It's COVID-19 Task Force at ontario.ca. Going forward, the province must provide greater clarity on changes in the vaccine rollout, both to their municipal partners, that's us, and to the general public. The confusion we saw over the last few days is a distraction from the important work that we need to do, and it causes everyone undue stress. I believe it's unfair to our residents to set up false expectations on how and when and where they will be able to receive their vaccine. The harsh reality is that Mississauga and all of Peel Region has not received an adequate supply proportionate to our needs since the beginning of this rollout. We've been the hardest hit region, harder hit than just about anywhere else in the province. Yet, we have barely received the provincial average when it comes to vaccine allocations. We need our federal counterparts to secure more doses of the vaccine. And we need the Government of Ontario to provide us with a steady and stable and reliable source of vaccine that matches the impact of the virus on Peel Region. We have done our part here, ramping up our efforts at our mass vaccination centres and at our hospitals. Last Saturday, by example, we administered more than 12,500 vaccines, and we are delivering that, at least that, each and every single day. In total, more than 300,000 doses of the vaccine have been administered in Peel, and we have the capacity to do much, much more if we receive a greater allocation of the vaccine. So let me be very clear, there is a difference between equality and equity. Right now, Peel Region is not equal to other regions across the province. Frankly, we need more vaccine than we are getting to properly suppress the virus here in Peel. And the sooner we vaccinate as many people as possible in hotspots like Peel, the sooner the rest of the province can get back to normal. The truth is that Peel is holding back regions like Kingston, Sudbury, Cornwall, and many other communities from moving out of this pandemic. So it's in the interest of the entire province to prioritize the hotspots. When your house is on fire, the fire department focuses all its efforts on putting out that fire, not watering the other houses down the street. So let's focus our efforts where they will make the greatest impact. Let's douse out the inferno that is Peel and Toronto first. Mississauga, you have my commitment that I will continue to fight hard for Mississauga and Peel to get our fair share of the vaccine. And I will continue to provide clear communications on who is eligible for the vaccine. As I've said, the fire in Peel Region and in Mississauga is raging right now. In Peel, our 7-day moving daily average of cases is at 747 cases, and that's up from 540 1 week ago. In Mississauga, we're now averaging 226 cases per 100,000, more than double just 2 weeks ago. The exponential growth that we are seeing is alarming. The third wave is hitting us and the entire province harder and faster than the previous 2 waves did. Schools have been closed indefinitely, small businesses as well. Our hospitals are now facing the most serious situation they have ever faced. Trillium Health Partners is seeing more and more patients transferred and elective surgeries cancelled. Trillium is now dealing with 127 COVID patients, 17 patients in the ICU, and another 23 suspected cases. The hospital is well beyond maximum capacity. The situation is similar at William Osler Hospital with 150 COVID hospitalizations, 25 in the ICU, and 76 suspected cases. These numbers have never been higher, and they are simply unsustainable. We are also seeing younger and younger people being admitted to the ICU, something we did not see in the first two waves either. What's clear is that in the race between the variants and the vaccines, the variants are winning. We are waging the biggest battle we've faced since last spring, and we again need all of your help in limiting the spread of this virus. I know we've asked a lot of you already, but please do your part in helping to make this the last lockdown. Please limit your trips outside your home to just getting the essentials and for exercise. Please limit your close in-person contact to just that of your immediate family. We need to do this for our overworked healthcare workers. We need to do this for our small businesses, for our essential workers, for our children, and for all of Mississaugans. We need to do this to ensure that this is the last time that we go into lockdown. I do truly believe that this is the final push, and that this new stay-at-home order will allow our vaccination program time to be effective and halt this virus for good. But everyone needs to take this situation extremely seriously and continue to listen to the advice of public health. Before I bring up Dr. Lowe, I do want to wish our Southeast Asian and South Asian residents a very happy New Year, as many communities across our city are celebrating the start of the New Year this week. And to our Muslim community, Ramadan Kareem, Ramadan Mubarak. I truly hope this holy and blessed month is a solemn period of thoughtful reflection. Also, to those who have celebrated Vaisakhi Day on Luk Luk Vidanya, I hope you all enjoyed a very happy Vaisakhi. To all of you who are celebrating and observing, I ask you to please exercise the utmost caution. Please only celebrate with those in your immediate household, and when you're attending the mosque for prayer, please maintain a safe physical distance from others. Remember, 15% capacity. That's it. Mississaugans, please stay healthy and stay safe. And now I'd like to invite up Dr. Lawrence Lowe to provide his update.
Thank you, Madam Mayor. Good afternoon. It's also always a pleasure to also be here with Chief Rizzi, and an honor to share the podium today with Dr. Sechiotu. Mississauga's weekly incidence rate for COVID-19 currently sits at 226.3 per 100,000, with a test positivity of 12.4%, which are the highest rates ever seen in this city since the start of the pandemic. We are seeing a severe resurgence in our community's third wave. Our hospital capacity is being overwhelmed, many lives, and our frontline healthcare workers are under threat. We know that our most vulnerable, our new and our racialized Canadians, our essential workers, and our elderly still remain very much at risk, but that the variants that are spreading are also sickening many younger residents as well. The grim pictures of tragedy that we have seen before from other jurisdictions are slowly manifesting, and they will be our reality if we do not act decisively now. To save lives, reverse the catastrophe, and exit with confidence, we must close, vaccinate, and exit. To close, you have heard what I'm about to say many times before, but never before has the urgency been greater or the stakes higher. Never before. This disease cannot spread if we do not meet. So please, stay home as much as you can. do not meet or gather in person. Postpone or meet virtually. Don't take any risks. If you must meet with anyone with whom you do not live with, ensure it is for an essential purpose. Mask, distance, and meet outdoors. Never meet if you are sick. Get tested and self-isolate instead. I call on our employers to also shift to virtual work if you can find a way. If work cannot be done from home, consider reducing capacity, rotating shifts, or supporting your workers to stay home for a temporary period, as we did in the first wave. I also encourage you to support your workers with paid leave should they fall sick or require access to testing or a vaccine. In respect of vaccinating, I want to clarify, as Mayor Crombie has, some of the recent provincial changes to prioritization and how they apply in Peel. New direction received from the province allows us to expand our mobile offerings while serving more and more residents through our mass vaccination clinic system. Our current system capacity is now nearly 100,000 doses per week. Together with our hospital partners, we have now administered over 300,000 doses in our mass vaccination clinics. These mass vaccination clinics are available for booking online by all residents over the age of 60, born 1951 or earlier, or residents aged 50 to 59 and living in a provincially defined hotspot, born 1951 to 1961. We are also currently vaccinating educators or special education workers as directed by local school boards, Indigenous adults, adults over 18 with highest risk and high-risk medical conditions, and healthcare workers or health-affiliated professionals. For those aged 18 to 49 living in hotspots, I want to clarify that while you cannot book yet at the mass clinics at this time, we know that the definition of 18 plus was designed to permit us to vaccinate all comers at planned community pop-ups. This represents a welcome expansion to our mobile program, which has to date delivered 10,000 doses since the start of our vaccination campaign to our most vulnerable, including the homebound, those living in shelters, and also seniors and other congregate and group living settings in our community. We are currently in active discussion with provincial officials to set up workplace vaccination clinics to vaccinate workers who cannot work from home and also their surrounding community. And we are also working with community agencies to launch pop-up clinics, including a pilot clinic that will target special education workers before the week is through. Please check peelregion.ca/COVID-19 vaccine and our social media channels for further information on eligibility, booking, and pop-ups as they become available. I want to take the opportunity to thank our community partners who are working with us to build vaccine confidence. The high stakes that we are facing extend to vaccine deployment as we continue to close, vaccinate, and exit. I continue to also urge all our residents, therefore, to do your part, stay apart, stay safe, and get the shot when it's your turn. Thank you, and I will pass it back to Mayor Crombie.
Thank you, Dr. Lowe. Dr. Lowe touched on some extremely important issues in his remarks, including building vaccine confidence. The truth is that while we're getting the vaccine out to so many people in our community, there are still some who are hesitant about receiving the vaccine. And that's why I've invited today Dr. Suki Otu, I knew I was going to move up, I'm going to mess it up, Dr. Suki Otu, to come here today to talk about the work that he's been doing in addressing vaccine hesitancy with the members of the Black community. Dr. Suki Otu, the floor is yours. Thank you.
Thank you, Mayor Crombie, and thank you, Dr. Lowe, for your advocacy. It's really important for everyone here. So why am I here? I'm here as a Black man who is a husband, a father, a son, a brother, and someone who works and lives in the city of Mississauga and works in the region of Peel and loves this community. And I've seen how the COVID pandemic has disproportionately affected members of the racialized community, Black community. And as a surgeon, a doctor at the hospital in Peel, I've seen how the COVID pandemic has destroyed families and destroyed people in the community. One of my close friends has his sister and his mother in an ICU, ventilated. I have another friend whose father lost his life because his PSW gave him COVID. But across Canada, 2/3 of Black Canadians are hesitant to take the vaccine. And I've seen this mistrust in Peel. I know there are very valid reasons for this hesitancy, but we have to get through this. I can tell you that the vaccine is completely safe. The vaccines that we have in Canada are 100% safe. I took my first dose in the beginning of January. I took my second dose at the end of January. And I took the vaccine to protect myself, to protect my family, to protect the people that I work with, to protect my patients, to protect the community of Peel. Getting the vaccine, washing your hands, wearing the mask, listening to the advice of Dr. Lowe and other experts is the only way we're going to get through this pandemic and prevent the fourth wave. We have to create the herd immunity. We also see that the COVID pandemic is affecting younger and younger individuals. We see that in the hallways of Peel and Mississauga, in the hospitals, the variants are dominating, and these variants are more virulent and they're killing our young. We have to get the vaccine into the arms of people before we get a new variant for which these vaccines are no longer effective, and then we have to start all over again. So I'm here to tell you about the Black Physicians Association of Ontario. We'd like to offer members of the community a culturally safe experience to get a vaccine. We have a dedicated Black Health Vaccine Initiative where we advocate, we educate, and then we vaccinate. We're hoping to get this initiative into the arms of people in Peel sooner rather than later when we get more vaccine. At the same time, I'm a member of the board of the Black Opportunity Fund, and you can review some of our educational materials on our website. And so for more information about the Black Health Vaccine Initiative, you can visit bpao.org. And for more information about the education materials that we have on the Black Opportunity Fund, please visit www.blackopportunityfund.ca, or you can email us at info@bpao.org or info@blackopportunityfund.ca. Thank you.
Thank you, Dr. Sukiotu. And now the work you're doing is simply incredible, and we thank you for it, and thank you for coming today and joining our press conference. And now all of us are ready to take your questions from the media. And let me remind you that Sam Rogers, who is our Director of Bylaw Enforcement, is also on the line if you have any questions for him.
Mayor Crombie, your first question comes from Mark Liverman at CP24. Go ahead, Mark.
Hey, Mayor. Just wanted to get some more updated information on the unconfirmed cases out of the brick distribution office in Mississauga. We're hearing there were at least 40 cases unconfirmed at this point at the distribution center. Wanted to know what's going on with that, and if you can talk a little bit about why the facility, as far as we know, is still open right now, Mayor.
So, Mark, you have more up-to-date information than all of us have. We're looking at each other, and this seems to be new news. I apologize, but I am going to ask Dr. Lowe if he has any more insight to come up and address your question. Thank you, Mark.
Sure, thanks.
Yeah, thanks, Madam Mayor. Thanks, Mark, for the question. As you know, Peel Public Health investigates all identified positive cases and clusters that occur in workplaces, and we will disclose information around investigations should there be deemed to be a risk to the public. Certainly, in the course of any workplace investigation, we will recommend closure should it be deemed necessary, particularly if it is identified that there is transmission or specific epidemiologic linking that is occurring. So I hope that answers your question just in respect of the specific place that you've identified. That's about all I can say at this point. Thanks.
Follow-up?
Yeah, so if it does turn out that there are these cases, and we are at the facility today, what what are the next steps? What can you talk about? I know in general we're talking to these types of facilities having outbreaks, but what are the next steps at this specific facility? Because as of right now, we're looking at an absolutely full parking lot of what's most likely employees that are still here right now with these unconfirmed cases.
Mark, I'm going to allow Dr. Lowe to address this. The same protocol exists in place to address these kinds of outbreaks for all employers. It is interesting how the media gets this information before the rest of us do. So, Mark, you have to give me the inside scoop sometime and let me know how you get to these so quickly. Dr. Lowe, can you explain what the protocols are? Over to Dr. Lowe.
Thanks, Mark. So just reiterating my answer, I think there's a recognition that in any workplace investigation, if it is identified that there is a risk to the public and or that there is widespread transmission, we would move to issue a closure order. This was done with at least one manufacturer, or rather a distributor, back in March. Of course, with an active investigation and no identified risk to the public, I'm not at liberty to disclose any further details. And I think the broader thing, it echoes back to the remarks that I have provided earlier on this afternoon. We are seeing widespread propagated community transmission. It is not surprising that you will find many workplaces that are in outbreak. It is not surprising that you will find many of these then resulting in close contact transmission within households. It is for this reason that I've asked people to stay home, to stay safe, to get the vaccine when it's their turn. And for employers, if you are able to either move virtually and or consider a temporary shutdown or closure and or reduced capacity during this third wave, that will go a long way to all of us preventing workplace outbreaks and keeping everyone safe. Thanks for the question.
We're ready for your next question.
Your next question comes from Sean O'Shea at Global News. Go ahead, Sean.
Hi, good afternoon, Mayor Crombie.
Welcome,
I just
Sean.
have one question, and that's...
Welcome.
Yes? Hi, thank you very much. Mayor Crombie, I'm wondering why, what your perspective is on a particular gym in Mississauga that has taken the position that, notwithstanding all of the emergency orders, they've decided to reopen. And bylaw officers have tried to get in all day, knocked on the door, they wouldn't open the door. What's your view as mayor of a city toward a business enterprise that says enough is enough and we're just going to open right now?
You know, I don't have a lot of tolerance for this, Sean. They know the rules. Everybody knows the rules. This is the most menacing of the three waves of this pandemic, and this is serious now. We've closed our schools. We've asked our retailers to close. We have not opened restaurants. Personal care providers could not open, and gyms could not be open. They know the rules, and once they open those doors, they will be issued a fine. We don't make exceptions because they have their own interpretation of the rules or how they should be. The rules are very firm and they apply to everyone, including this particular gym. I've got Sam Rogers on the call. Sam, I'd like you to comment as well. I know you have a team out there, and then Dr. Lowe would like to make a comment as well. Sam? While Sam is coming on the line, I'll ask Dr. Lowe to come forward. We don't have a lot of tolerance for this, Sean. We're going to give them the maximum fine.
Yeah.
I can.
Oh, go ahead, Sam.
Oh, please, yeah, thanks, Dr. Lowe. I had a little audio check. Can you hear me okay there?
Yeah, I can hear you.
Okay, great. And thank you, Mayor Crombie, for the opportunity. Yes, I can confirm that this morning municipal law enforcement officers did investigate reports that the gym establishment was operating in contravention of the provincial regulations. As an update, I can advise you that as a result of the investigation, we will be pursuing Part 3 obstruction charges under the Reopening Ontario Act. And as Mayor Crombie already said, we've done our best to work with all businesses to ensure that they understand all of the regulations and are compliant with the rules. But this sort of intentional violation can't be tolerated if we're going to help stop the spread. So we will be pursuing those charges. And one other point, I just want to advise that we're not seeing this as a trend at all. Gyms have been an issue in the past, but that is not the case. And I want to thank all businesses in the city of Mississauga who have been showing an excellent level of compliance throughout, and we don't see this as a trend. Thank you. I'll hand it over to you, Dr. Lowe.
Thank you, Sam. And I would start out by thanking our businesses as well. I know it has not been easy, that this pandemic has seen these prolonged closures. I understand the frustration from business owners, and I certainly have seen it, especially during the interwave periods where there were questions around where the source of spread was and why and all those other pieces. But I want to make very clear and just reiterate my remarks from earlier during this press conference. This is not a drill. There is a significant overwhelming of our hospital at this point in time. You've got the emergency department at William Osler that's now being run out of the fracture clinic. You've got Trillium Health Partners that has a pandemic response unit, people that are fighting, gasping for their lives, fighting and basically trying to stay alive, and people who are succumbing to this disease in greater and greater numbers. I don't know what part of that people are not getting or understanding, but this is no joke. We have transferred patients as far away as London, as far away as Niagara Falls, as far away as Kingston. They're being transferred all over the province. They are, of course, our seniors, our elderly, our most vulnerable, our racialized populations, the people that would never dare to go against something, and to go against these laws, the people that have, kept our economy moving throughout this. And, I think it really comes to the issue with this whole disaster is that the people that have been impacted by this disease are unfortunately not the same people that have been impacted by the measures. And so I certainly share Mayor Crombie's passion. It's disappointing for me as a medical professional to hear that, especially at this stage in the pandemic, when we are so close, that we would choose to break ranks and actually not take the opportunity to try to get through this together. So it's disappointing, and I just felt the need to really highlight, this is no joke. Our hospitals are seeing something that we never thought we would see in Canada, and I ask the community to respect that. Thank you.
Sean, you still there? I think he's left.
You've answered my question. Thank you very much.
Yeah. We won't tolerate any flagrant breaking of rules that way. Our bylaw does our best to go in and educate and inform, but when it's flagrant like this, then this is when we throw the book away and throw it right at them.
Your next question comes from, it's actually for Dr. Lowe, and comes from Isaac Callan at The Pointer.
Thank you, Isaac. We'll bring up Dr. Lowe. Thank you.
Thank you. Hi, Dr. Lowe.
Hi, Isaac. How are you?
I'm good, thank you. How are you?
Good, thanks.
So in the context of the announcements that both you and Mayor Crombie have covered this week from the province, and in the context of limited supply, it feels like there's something of a tension playing out between the mass vaccination clinics, which you've said are the fastest and most efficient way to vaccinate people, and then the mobile clinics, which are perhaps the best way to get to the people who are harder to access and right on the front lines more immediately. I just want to know how you're addressing this tension and how you're going to balance the need to get the right people with the need to do as many vaccines as possible.
Well, Isaac, we are doing the right people in our mass vaccination clinics. 85% of Peel's population lives in a neighborhood that's defined as a hotspot. And I think as we continue to monitor and evaluate the vaccine rollout in our mass clinics, we are seeing many people from racialized communities, many people who come from a diversity of socioeconomic backgrounds in our clinics. I think the thing I would say is you need both. And we have always had both, right? So we have our mass clinics, which are continuing to vaccinate 100,000 people a week, and with more and more capacity being online, working with community agencies to push people to those facilities as much as possible. But we also have our mobile clinics, which, in line with the province's previous prioritization, was very much focused on homebound individuals, seniors, apartments and condos with large senior population, group living homes, shelters, etc. So I think there's not really a tension. You need both, and we're continuing to ramp up our mass vaccination clinics while also welcoming the opportunity to expand our community outreach and mobile opportunities to now include community and workplace pop-ups. Is there a follow-up?
Yes, please. So the way the province has changed its prioritization in the last week is perhaps a little different to the plan that Peel Public Health originally rolled out. And I know Mayor Crombie's talked about the need for more supply. If the province isn't to provide more supply in a worst-case scenario for some of these pop-ups, will you reallocate some supply away from the mass vaccination clinics, or is your focus going to be keeping those mass vaccination clinics running the way they are now?
It's a good question, Isaac. I think we're looking at every option, of course, and really trying to navigate that. I think you'll notice, however, that many other jurisdictions that may have recently canceled appointments, a lot of that actually speaks to just the limited supplies that have been diverted amongst many different channels. The reality is that the supply of vaccine we have is finite. So if you take it away from the mass clinics, it's going to go to mobile, or if it's going to go to primary care or pharmacy, then you're going to see less throughput on mass. We're going to have to cancel clinics there, and really try to figure out how we balance things. So again, it is a matter of trying to ensure that we are getting through this as quickly and expediently as possible. I think all of us can agree that our desire is to make sure that we hit that community immunity threshold in the quickest manner possible to hopefully see the back of this thing. Thanks so much.
Next question, please.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Thanks, Mayor Crombie. My question is actually for Dr. Lowe.
Okay, no problem. We're going to bring him up.
Hi, Steve. Go ahead with the question.
Thanks. Just wanted to ask, earlier in the presser, we heard that when these additional mobile and pop-up vaccination units happen in the city, that there won't necessarily be they won't be widely advertised. I just wanted, could you tell me a little bit about the rationale behind that and why that kind of decision was made, or the choice was made to do that?
So, Steve, I believe those are actually from Mayor Crombie's remarks, but I think to the extent that we would publicize them to the neighborhood or to the workplace or wherever they were, I think there would be that communication. There's no point in holding a pop-up if people don't come. But I think what you don't want to have is, especially if it's being targeted to a specific pop-up or workplace for a specific purpose, is maybe people who don't necessarily live in that area coming out. So I mean, I can't necessarily speak for the comment as it wasn't mine, but I think the aim with any of these would be to ensure that it is publicized appropriately to the neighborhoods in question. And I don't know, Madam Mayor, if no, okay, I think that speaks to it. I mean, obviously, a pop-up will be appropriately communicated to the community and the workplace for which it is intended, and to ensure that that community or workplace receives the attention that it deserves.
Thanks. And actually, just wanted to ask either Mayor Crombie or Sam Rogers about the charges, these Part 3 charges that were mentioned. Can you kind of outline what the city would be planning to charge, like when this boxing gym is, I guess, connected with?
I'm going to ask Sam Rogers to respond. He has good experience with having set these fines and delayed them previously.
Yep. Thank you, Madam Mayor. And hello, Steve. Yep. So it's very early, so I can't give all of the particulars of the charge, but this is a Part 3 charge for obstruction, and so the penalties and the fines will be assessed by a justice of the peace, and for an individual that can go up to $100,000, and for an individual or a director of a corporation up to $500,000. A corporation is $10 million, but in this case it would likely fall under an individual or an individual as a director. So $100,000 or a $500,000 fine. We are still processing the evidence. This is very early, but I did want to provide the update today. Once our summons is sworn in by the justice of the peace and served, then we'll get more details around when a first hearing will occur, and things will fall from there. But this isn't a standard Part 1 $880 ticket. This is for obstruction. Officers were unable to complete and perform their duties to the fullest today while responding to the reports of this gym establishment operating. I'll leave it there and hand it back over to Mayor Crombie.
Yeah, Steve, this just defies logic. On a day when Peel has posted 935 cases, we have gyms flagrantly breaking the rules. This is wrong on so many levels. We need to get through this, but we need to do it together. I know businesses are frustrated. They've been frustrated for a very long time. I know they can't wait to reopen, and gyms in particular, personal care servers, restaurants, these are the kinds of businesses that haven't been open for over 4 months. And and we all sympathize with that. But with the kinds of conditions that we're experiencing right now with our case counts and the variants that are rampant, and the conditions in the hospitals such that if you needed personal care in a hospital, if you experienced a trauma or needed treatment, you wouldn't be able to receive it. Let's use some common sense here, folks, please. It's not a time to open a gin or try and flaunt the rules. That's just wrong.
Your final question for the day comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Thank you, Daniel. How are you, Mayor?
I'm so very well. I'm healthy.
You're theming.
Yes, I don't like hearing this. You know, I didn't know about the brick outbreak, and that disappoints me so greatly. And I was unaware. And this Jim flaunting the rules is just wrong.
I hear you. Anyhow, let's go with the question. Do you agree on such thing that there is a vaccine that is 100% safe?
Well, so, you know, we have to look generally at vaccines and how they have eradicated diseases like smallpox and polio and measles, mumps, rubella, chickenpox, etc. Are vaccines foolproof, about as foolproof as you can get? Will no one suffer an adverse effect? Of course, there will be some people, a very small percentage of people, who will have an adverse effect. Maybe they have an allergy to one of the components. But generally, vaccines are very safe. I know that the new Johnson & Johnson, I think there were a total of 5 cases out of 11 million. And, you know, I know that they're investigating whether those cases are directly tied to the vaccine, but we also know that in under 1% of all cases, there could be some sort of adverse reaction, despite no matter what the vaccine is. This is common knowledge, and this is very acceptable. Let's look at how many people the virus is killing. And this will save everyone, 99.99% of people, from the very harsh realities of the virus. I don't know, would you like Dr. Lowe to comment on that? He's the medical expert, not me. Dr. Lowe,
and Dr. Faki as well, because he said 100% safe today. Especially, I'm talking about the existing vaccines, which have not yet proven 100% safe.
Okay, I'll let the two doctors respond.
When I heard this.
Our guest has not had an opportunity to respond to questions. I'll let the doctors respond. I just sharing with you common knowledge, and I'll let the doctors give you the science, the evidence, and the medical response. Thank you.
Thanks, Mayor Crombie, and I'll pass off to Dr. Seiciotu to also add his thoughts. You know, Khaled, you raised a good question. When it comes to any medical treatment, drugs or vaccines, there are possibilities of side effects. We do know that these are things that are taken very seriously by our vaccine safety colleagues and that are monitored. Typically, so far, the vaccines have been shown to have very mild side effects in the vast majority of situations, usually a sore arm, you know, redness at the injection site, maybe a mild fever, which really reflects your immune system fighting off the dummy virus or essentially the priming to make sure that it's ready to actually fight off the real invader if it actually shows up. But I think a lot of the concerns around the more serious side effects, I would say, warrant a question, first of all, as to the nature in which those side effects manifested. So understanding, was there, first of all, was it actually related, like did the vaccine cause it? And second of all, in the event that there is an association, what were the factors that led to it? Was there a specific rare condition? Was there something that led to that intervention having some sort of side effects? And once the vaccine regulators examine this, then they will try to determine if this is something that is concerned on a broader community or population level, or something that results in a specific contraindication to use. And in any case, what they always are looking at in respect to side effects is they're trying to balance out the side effects of the intervention versus the actual outcomes related to the disease. And I think we know that the outcomes related to COVID-19, aside from the fact that it is literally a roulette wheel, as in you don't know whether you're going to have mild symptoms or if you're going to end up on a ventilator in the ICU, versus the very, handful of cases in a million of some, or millions and millions of some of these severe side effects, needs to really put into perspective the question of, would you prefer to get the vaccination or would you prefer to get COVID-19? I think the balance of probabilities based on the severity of illness that we are currently now seeing in our hospitals during this third wave would likely suggest that most people would be better off getting the vaccine. And so I know Dr. Seiciotu is very passionate about vaccine confidence, so I wonder if he would like to maybe add to this as well. Thank you.
Yeah, I think Dr. Lowe said it better than I could. I think there's always a risk-benefit to any medications you take, whether it's a drug or vaccine. But what I really want to focus on really is the fact that it's hard to explain to people that are not in healthcare the physical and mental stress that this has put on our healthcare system. I'm talking to my colleagues, nurses and doctors at 10 o'clock at night, trying to just, we're just trying to support each other. And then, of course, there are patients. We have patients that have had deferred hip and knee replacements, patients that have had cataracts deferred because they can't see. And, there's a trickle-down effect that we really need to get back to. And so when I hear about gyms being still open, it just really is an insult to, what we're trying to do here as healthcare providers for our community and for our patients.
Thank you, Khalid. Is there a follow-up question?
Yes, actually there is a follow-up, and it may go as well to Dr. Otosaki. First of all, I appreciate all the efforts you are doing, especially the Black Vaccination Initiative. Do we need Black, Asian, Whites, Indigenous, or do we have to adhere to one system and trust it?
Well, I think every community is a little bit different, and, there's some more readily accept vaccinations than others, and it's important we do the outreach to every community. And we know very well that if we vaccinate people in their place of worship or their cultural center, they're more likely to come out. They have a greater confidence. So why don't I ask the two doctors to respond to that as well?
Thank you.
Yeah, so again, I think Mayor Crombie said it better than I could. Really, the issue about vaccine hesitancy can be very specific to cultures. So, the time we have, there's not enough time to discuss why individuals in the Black community are hesitant against the vaccine. But it deals with a lot of historical issues about racism, anti-Black racism, both from the time of slavery to present. The Indigenous community have some and different similar experiences, but that needs to be brought into a conversation that we don't have time for today. But what I can say to you is that people feel more comfortable when they have treatment by people that look like them.
And thank you, Mayor Crombie, Dr. Otu, for your answers, and thank you, Khalid, for the question. I think throughout this entire press conference, one thing that has struck me is that I feel like I'm being presented with a number of false choices, like false dichotomies. And I think it's like, mobile or mass, general population or targeted strategies. And I feel a little bit like the Taco Bell meme where it's like, well, why not both, right? I mean, I think we need to do all of it. And I think to the extent that we will put our focus and emphasis on different aspects of the system, yes, our big focus is on mass vaccination clinics, and that's how we're getting 100,000 people through the system a day, 400,000 people a month, which, by the way, 1.5 million people in the region of Peel, you do the math, right? I mean, we're months away from getting to a first dose for everyone in the region of Peel if you're doing 400,000 a month. And so I think you got that, but you do have to have the mobile strategy as well to get out to the workplace, to get out to the vulnerable people, and making sure that to the extent that you can do both of them without compromising the other is how we work through it. And in the same way, when it comes to vaccine confidence, you absolutely are working on the population, the community as a whole, but you do have to recognize that based on our diverse backgrounds, and we have one of the most diverse communities in Canada here in the region of Peel, and Peel, this is the strength of local public health. We in Peel Public Health knew knew this. We were one of the first health units to start collecting data on COVID-19 cases by race and occupation, self-identified. We were one of the first health units to start engaging community ambassadors during the interwave period as we moved forward. And I think there's a recognition here that we as local public health and local public health across Ontario do this. They know their community and they know the diversity exists. So I don't see it as a either or. I see it as, you've got to get it to, the overall community as a whole, and you've got to have those targeted strategies that really take into account structural, social determinants and historic injustices to ensure that you're actually bringing those people on board and bringing them with you, giving them the confidence to also be part of this compact. Thanks very much for the question.
Are there any further questions?
That concludes your that concludes the questions for today. I thank everyone for joining.
Thanks very much.